The Pulmonary Center caters to a number of different disciplines here at Washington University, all of whom are interested in improving the health of children with chronic lung diseases. Neonatologists, pulmonologists, critical care physicians here within the department, as well as clinical and basic scientists from outside of the Department of Pediatrics are all participate in the center, are all vital to its function.
Yeah.
But the opportunity to have these really smart people who are all very much interested in the same, who have similar if not the same common goal, to be able to meet and to develop collaborations, to develop research projects, to really be able to further our understanding of pediatric lung diseases is, I think, truly remarkable. I don't think there are very many places in the country that provide this kind of environment, this kind of collaboration to allow us to answer the questions that I feel are important for pediatric health. There are any number of questions that need to be addressed in pediatric lung diseases. Understanding the pathophysiology and the natural history and hopefully interventions to prevent chronic lung disease in premature children has to be a target. Trying to understand the pathophysiology of a number of suppurative lung diseases like cystic fibrosis and primary ciliary dyskinesia, I think, are important, not so much to understand why the diseases occur, but more where can we intervene. How can we apply new drugs, new approaches to care that will have a profound impact in the pulmonary health of these patients. The Pulmonary Center provides a unique opportunity to really expand the depth and breadth of research into pediatric lung diseases. The resources that it provides and the opportunity to collaborate with a number of investigators, some within the Department of Pediatrics, others from outside, has been invaluable for the work that we've been doing. We are participating in an NIH-sponsored multi-center consortium looking at primary ciliary dyskinesia. In the context of this work, it kind of occurred to us that there may be other patients that have primary ciliary dyskinesia or have ciliopathies, but may not be quite as severe, particularly individuals who have chronic otitis media. Primary ciliary dyskinesia is considered to be a relatively rare lung disease occurring in roughly about 1 in 15,000 individuals. It's an unusual disease that is clinically manifested by chronic ear infections, sometimes with hearing loss, persistent sinusitis, chronic bronchitis that ultimately results in the destruction of the airways leading to bronchiectasis. 50% of the patients have what's called situs inversus totalis, where all the organs are kind of flipped in the opposite orientation. So your heart's on the right instead of on the left, your liver is on the left instead of on the right. And there's even a smaller number who have heterotaxy where the organs are just kind of jumbled a bit. Otitis media is a fairly common problem in children. It accounts for an awful lot of physician visits and many parents' sleepless nights. And it's fairly clear if you work with kids long enough that you recognize that there are some children who have otitis media more often than others, or their otitis media doesn't seem to clear terribly well, which is a feature of primary ciliary dyskinesia. So through the support of the Children's Discovery Institute, we've been able to put together a group of investigators here at Washington University, both here on the medical campus but also on the Danforth campus, who are very much involved in trying to better understand or maybe characterize the cilia function and the cilia genetics in these children. Each of the members of the team are providing a different expertise that is helping us, which I expect will help us to really better understand or better define these patients and determine whether some of these patients that are being seen in fact have perhaps a genetic predisposition to otitis media.